In this video, we are going to talk about importance of red wine in human health. So before starting this video, like this video and subscribe to our YouTube channel for future updates. Ongoing debate centers on the question of whether or not consuming red wine has any discernible positive effects on one's health. However, research has shown that consuming a moderate amount of red wine on a daily basis, particularly wine with an alcohol content ranging from 12% to 15%, is beneficial in preventing a variety of diseases. In particular, wine with an alcohol content ranging from 12% to 15% has been shown to have this preventative effect. This is particularly true for wines with a higher level of polyphenols, which are antioxidants. Several different research all point to this one result. It is essential to bear in mind that there is only a little line between moderate activity and excessive behavior, and this difference must be remembered at all times. Drinking an excessive amount of wine may have a detrimental effect on a person's health. On the other hand, eating too little of it won't give you with the same benefits that moderate drinkers often take delight in enjoying. Moderate drinkers consume an appropriate amount of alcohol. What are red wines? Red wines are made by crushing and fermenting whole, dark-colored grapes, and the resulting wines may have a range of flavors and colors depending on the kind of grapes used. Red wines are the most common type of wine. There are many different kinds of red wine, the most well-known of which are Shiraz, Cabernet Sauvignon, Merlot, and Pinot Noir. Other varieties of red wine also exist. Here are some of the health benefits associated with drinking red wine. Number 10. Rich in antioxidants. Before you can even consider sipping a glass of red wine, you need have a solid foundational knowledge of wine in general. This is particularly relevant when discussing red wines. Because it has a high concentration of powerful antioxidants, it is essential to take into account both the possible advantages and the potential problems that its use may have on one's health. Darker grapes include a higher quantity of the antioxidants resveratrol, epicatechin, and catechin, as well as proanthocyanidins. Resveratrol and proanthocyanidins are the two of them that play the most significant roles in ensuring your continued good health. Number 9. Lowers bad cholesterol. It's common known that consuming red wine may help lower your levels of bad cholesterol, and research backs this up. According to the findings of a study, drinking red wines produced from Tempranillo grapes, which are well known for the high fiber content that they contain, may help lower levels of bad cholesterol that are detected in the body. Rioja is one example of a wine that falls under this category. Number 8. Keeps heart healthy. It not only helps to maintain good cholesterol levels, but it also helps to maintain a healthy heart. Polyphenols are a kind of antioxidant that is present in red wines. Polyphenols are abundant in red wines. They prevent the production of unwanted blood clots by keeping the blood vessels flexible. However, it is important to remember that excessive drinking might be harmful to one's cardiovascular health. Consuming polyphenol-rich foods and drinks, such as red wine, has long been linked to a lower risk of heart disease. Red wine has the ability to preserve the lining of blood arteries in the heart while also increasing HDL, or good cholesterol, which aids in the removal of bad cholesterol from the body. Number 7. Regulates blood sugar. Resveratrol is a naturally occurring compound found in grape skin. Diabetics may be able to manage their blood sugar levels by consuming resveratrol. Participants in the research who took resveratrol supplements at a dose of 250 mg once a day for 3 months had considerably lower glucose levels in their blood than those who did not take the pills. The study's results were provided in the form of a table. Resveratrol lowers systolic blood pressure while also lowering total and LDL cholesterol levels. According to the American Diabetes Association, despite its natural sugar content, red wine may help manage blood sugar. Red wine may reduce blood sugar levels for up to 24 hours, which may be advantageous for persons who have high blood sugar levels. While red wine should not be used in place of blood glucose control drugs or treatment strategies, it may be a beneficial dietary complement when consumed in moderation. Number 6. Reduces the risk of cancer. Drinking red wine on a regular and modest basis has been demonstrated to successfully lower the chance of developing a range of cancers, including basal cell, colon, prostate carcinoma, ovarian, and others. Researchers discovered that treating human cancer cells with resveratrol at high enough concentrations allowed the molecule to disrupt the main function of a protein that promotes cancer development and spread. Recent research suggests that red wine may be able to lower cancer risk by blocking the formation of malignant cells, especially those connected with breast cancer and esophageal cancer. According to cancer experts, resveratrol, a polyphenol found in grape skin, may really destroy cancer cells. Number 5. Helps fight off viruses and treat common cold. Keeping our immune systems healthy against viruses is critical, and red wine may have another intriguing benefit in this regard. Red wine may also help your microbiome, or the good microorganisms in your stomach. A good microbiome may help prevent disease, but an unfavorable microbiome can lower your immune function, leaving you more prone to illness. Not only may red wine help you avoid the common cold, but it may also protect you from other infections. Red wines, which contain antioxidants with anti-inflammatory qualities, are an ideal option for flu treatment. This is due to the presence of antioxidants in red wines. This is because antioxidants shield cells from the destructive effects of free radicals, which are thought to play a key part in the development of a variety of ailments, including cancer and the common cold. Number 4. Keeps memory sharp. Do you want to learn the information and skills required to maintain a healthy memory? According to research, the antioxidant resveratrol, which is contained in red wines, may be able to inhibit the creation of beta-amyloid protein. This protein is hypothesized to have a role in the progression of Alzheimer's disease. The beta-amyloid protein is a necessary component of the plaque that forms in the brains of Alzheimer's patients. Another surprise red wine health advantage is its probable capacity to lessen the risk of dementia, a group of disorders that damage cognitive function, usually in older age. Studies suggest that drinking red wine may lower your risk of dementia, which typically leads to Alzheimer's disease, explains nutritionist Sally Stevens, RDN. The trick is to consume red wine in moderation, since excessive intake might actually raise the risk. As a result, it's better to limit your consumption to the recommended 5-ounce glass each day. Number 3. Keeps you slim. You will be glad to find out that resveratrol may also help you maintain a healthy body weight, which is another benefit of taking it. The chemical molecule pisietanyl, which is formed from the compound resveratrol, is responsible for the decrease in the number of fat cells found in human bodies. According to the results of the research, pisietanyl has the ability to fasten the insulin receptors that are located on fat cells, which prevents immature fat cells from developing along the pathways that are required for their maturation. Number 2. Reduces the risk of depression. According to the findings of a study that was carried out on participants ranging in age from middle age to elderly individuals, frequent use of alcohol in moderate amounts was shown to be associated with a lower risk of depressive symptoms. Participants in the research varied in age from those in their middle years to those in their latter years. Persons who drink red wine on a regular basis have a lower risk of acquiring depression compared to those who do not drink red wine. This is in contrast to people who do not drink red wine. Number 1. Has positive effects on the digestive system and promotes eye health. Red wines, which contain antibacterial properties, have been demonstrated to be effective in the treatment of stomach aches and other digestive disorders. Citation required. This is due to tannins in red wines, which contribute to this impact. Drinking wine has also been shown to reduce the risk of infection with Helicobacter pylori, a kind of bacterium that is often found in the stomach. The health advantages of red wine are enhanced still more by resveratrol. Red wine, which has vascular enhancing qualities, may increase microcirculation in the eye. This procedure may aid in the prevention of vision-threatening conditions such as age-related macular degeneration, diabetic retinopathy, and glaucoma. What do you think about this video? Do let us know in the comments section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.